Hello everybody, I am Dr. Kulin Shah and I am a diabetologist practicing in Ghatkopar East and West, and I see cases of diabetes, thyroid disorders, obesity, PCOD, osteoporosis and related issues. Today I will be talking on thyroid disorders. Now to just in brief to let you know about the thyroid disorders, let us start with the thyroid gland. Now, thyroid gland is a small endocrine gland which is situated in the front of the neck, and it produces thyroid hormone. Now, the thyroid hormone is basically used by each and every cell of the body to carry out its function. There are two types of thyroid disorders which we encounter in day-to-day practice. One is the hypofunctioning or the slow functioning of the thyroid gland, which is known as a hypothyroidism. And the other one is the overfunctioning of the thyroid gland, which is called as hyperthyroidism. So in day-to-day life, for the normal activity of the body, it's very essential to maintain a fine balance for the thyroid gland. Now these kind of thyroid disorders are increasing day and day in our practice. Now what is the reason for the increase in these thyroid disorders? The first and the most important is the defective digestion which we are encountering nowadays, which leads to the buildup of toxins in the body. And the toxins, they might attack the immune system and of course the weak gland, which is the thyroid in most of these cases, and that is why it causes the malfunction of the thyroid gland. The most common dysfunction which we are seeing in thyroid is hypothyroidism, that is the low functioning of the thyroid gland. Now so what are the symptoms of hypothyroidism? So it's basically the low thyroid function causing the low metabolic activity of the body, leading to weight gain, delayed physical response, delayed mental response, hair fall and laziness and constipation. Women also have menstrual disturbances. So these are to name a few. Now how do we diagnose the case of hypo or hyperthyroidism? Now basically on the symptoms what we receive, we ask the patients to go for the thyroid function test. So essentially the first important test what we advise is the TSH levels. If the TSH levels are slightly on the higher side, we are higher side on the lowest or on the lower side, then probably we would ask the patients to get the other part of the thyroid function, that is the T3 and the T4 levels. When the TSH is on the higher side and the T3 and the T4 are either on the lower side or in the normal range, then probably this is suggestive of hypothyroidism. And when the TSH is on the lower side with the T3 and the T4 on the higher side, then this is suggestive of hyperthyroidism. So what are the symptoms of hyperthyroidism? The symptoms what we see in the hypothyroidism is exactly opposite what we get in hyperthyroidism. So this is basically unexplained weight loss, anxiety, increased heartbeats which is called palpitations, loose motions, hair fall, increased perspiration, increased heat intolerance, and also menstrual abnormalities in females, probably absent periods. Now once we have, if you suspect that you have these kind of symptoms, then probably you can visit your doctor who would advise a thyroid function test. Now the results which I have disclosed discussed further, before. So these thyroid function tests would reveal the nature of the disease, whether a patient would have hypothyroidism or whether he has hyperthyroidism. So if you are suspecting any of those abnormalities, please contact your doctor to proceed further with the investigations. There are two kinds of therapies which are available. For hypothyroidism, we supplement the patients with thyroxine supplements, and for hyperthyroidism we give tablets which block the thyroid conversion. Thank you.